Good evening. I'd like you all to just close your eyes for a second. Today's Thursday. What did you do this Thursday? If you're like the rest of us, you had a lot of meetings, you drove, you ran a lot of errands, maybe took your kids to school, band practice, sports game. What about next Thursday? What do you have next Thursday? Upcoming travel? More meetings? How about the Thursday after that? The Thursday after that? And the Thursday after that? And what if I told you, just think about this for a second, if this Thursday you had come to my office and learned that you had a diagnosis of metastatic cancer. This happens every Thursday and almost every day to many of our patients. And then you learned that the best treatment for your cancer was to come and start getting a treatment next Thursday. And you'd say, of course, Dr. Betof, of course I'll clear my calendar. Of course I will cancel all of my meetings. I will cancel my travel. And then I told you that that treatment would need to happen every other week for the rest of your life, as long as it works. And all of a sudden, canceling every Thursday and every trip and every family vacation and working that around the treatment that's keeping you alive, well, that sounds a lot harder. Now, what if I told you there may be a way to treat cancer without getting treatment every week or every other week or once a month? And that is truly where we see the promise of using the immune system to help to treat and potentially even cure cancer. So we all know that the immune system is able to recognize bacteria and viruses and clear them from your body. And for many, many, many years, it has been an open question whether the immune system could recognize cancer, see it as foreign or something that doesn't belong, and treat and kill that cancer. And in fact, this has been going on for quite a long time. For those of you who are at least familiar with this concept, that picture in the middle is Sir William Coley. This is an article from many years ago, over 100 years ago, with a picture of that patient seen here on your right. This patient had a soft tissue cancer called sarcoma. This was completely incurable at that time, and still, for the most part, in 2025. Dr. Coley recognized that if this patient got an infection, which they did, called erysipelas, the immune system could actually treat and kill that cancer. And that, in fact, is what happened to this patient. And this patient was cured of their soft tissue cancer from an infection called erysipelas. We then spent another 100 years trying to iterate on this concept and bring this treatment in a controlled way to our patients. And this led to the world revolutionary treatments that we now know as cancer immunotherapy. This was Breakthrough of the Year. This is Science Magazine in 2018. You can see 2018, the Nobel Prize for medicine and physiology. This is awarded to Dr. James Allison and Tasuku Honjo for the discovery of immune checkpoint inhibitors, which is the modern immunotherapy that we use for our patients every single day here at Stanford. The downside is this works for less than half of our patients. So how do we make this better? What's next? So let me tell you about a treatment that I have been working on now for almost a decade that we now have brought to our patients here at Stanford. So this is a treatment called tumor-infiltrating lymphocytes. That is a long name. We call them TILs. And you can see in this slide a picture of a patient who has a tumor in their abdomen. If we take out that tumor or a piece of it, we will find those orange immune cells called TILs, tumor-infiltrating lymphocytes. Those are immune cells that actually recognize the patient's cancer, but for whatever reason weren't able to kill it yet. And our question has been, can we supercharge those cells to become a cancer medicine? So this patient undergoes a surgery. We identify those red TIL or orange TIL cells, put them into a dish, expand them into the many billions of cells, freeze them and prepare them as a living cancer medicine. Our patients then come in. You can see normal immune cells floating around their body here in blue. They get a very tough treatment. They get 5 days of chemotherapy. That gets rid of those normal immune cells that aren't currently helping the patient and aren't killing the cancer. Those go away. The patient is then infused with those TIL cells, followed by the hardest part of this treatment, which is infusion of a medicine called IL-2, which is needed to keep those TILs alive, replicating, and tells the body to start making them itself. And in a one-time treatment with this TIL therapy, we can see those TILs come into the tumor, as you see here in orange, and make that tumor go completely away. And then our patients walk out of our clinics potentially cured of a solid tumor. Now, how well does this actually work? Well, we give this every single day here at Stanford now. This was approved by the FDA on February 16th of 2024. Just 4 very short days later, 1 business day after a holiday weekend, our team here at Stanford did the first surgery in the world to take those TILs out. And August 4th of 2024, we infused the first patient in the world with the commercial drug that is this TIL therapy known as lifileucel. Since that time, we've treated countless patients with metastatic melanoma where this drug is approved, and we are now bringing this to other types of cancer. But I'd like to just share with you a story from one of our patients. So this is a patient of mine. Her name is Donna. Donna is the oldest patient we have treated with this therapy here at Stanford. She's nearly 80 years old and had previously been told she was not eligible for this treatment because of her age. So this is a letter that Donna wrote to me. Dr. Betof wanted to see me, not just the numbers on my chart, not just my age, but she wanted to see me, see if I had enough spark in me to go through what was coming. This treatment, it's called TIL. They take my melanoma, my cells, and they turn them into an army to fight my cancer. She looked me in the eye and said, "I think you can do it." She believed in me, that I could take this on. And let me tell you, it's no walk in the park. It's fire. It's hell. Dr. Betof didn't sugarcoat it and told me, "You're going to be very sick." But I said yes. What else could I do? Immunotherapy didn't work on me. 6 long years of infusions and the cancer just laughed. Nothing worked. And in the meantime, I lost time, I lost strength, I lost so much, but I didn't lose me. I said yes, not because I'm brave, not because I'm hopeful, because I'm not ready to stop. They told me the success rate is only 31%. But you know what? Someone has to be in that number. Why not me? So we'll fast forward to after Donna was treated. Today, Dr. Betof didn't even say hello. She burst into the room practically yelling, "Have you seen your scans from last week? Everything is shrinking." She and Laura Morris, her right-hand angel, were ecstatic. My melanoma is shrinking in 6 weeks. This was written to me by Donna Now, several months ago, she's now taken trips with her family, traveled around the world, and is back to living her very active life, and just celebrated her 80th birthday. So what's next? Where do we go from here? Well, you heard in Donna's own words, this only works for 31% of our patients, and right now is only available for metastatic melanoma. We need to make this treatment better, and we need to bring it to more, if not all, of our patients with solid tumors. And that's exactly what we're doing. That is the innovation that is happening here at Stanford. Right now, we are running clinical trials of new innovations on this technology, engineered cells so that we don't have to give that IL-2 medicine, that allow more patients, older patients, sicker patients to be treated. We've now figured out that this can be effective for patients with lung cancer, and we have patients admitted today undergoing treatment for non-small cell lung cancer with exactly this technology. We're bringing this to other solid tumor patients who right now do not have a cellular therapy option. And probably most importantly, in my laboratory, we are bringing samples back from our generous patients. Every single patient who has chosen to undergo this treatment has offered to donate their tissue, washings from that TIL infusion, their tumors, and blood samples, so that my laboratory can help to figure out who's in that 31% and why. And most importantly, how do we make this better for that other 69%? And how do we bring this to all of our patients here at Stanford, across the country, and around the world? So if you ask what's next, I think the potential is for a one-time treatment for a patient with solid tumors. Is it tomorrow? Probably not. But is it actually possible? With our team here, I believe it is. Thank you.